I think there's a reason why both Angry Birds and Clash of the Titans made it to the top if the Finns downloaded so much, right? To speak about great and cool solutions from Finland, we have two ladies joining us. First of all, we will have Anna from National Institute of Health and Welfare, who's a development manager there. And Anna confessed that she has actually never used Twitter before. So, but she might have a reason after today. So all of you tweeting, there's no handle for her yet, but just if you put it out there, she will find it afterwards, okay? And then next we will have Laila coming from Finnish National Board of Education. She's an application manager there. And the fun thing about her is that although she has studied nothing technical in her life, right? But at the same time, all her life pretty much she has worked with technical things, databases, registries, and so forth. So I'm sure she will bring a great user perspective to the podium here. But you want to take us forward? Come to the stage.
Thank you, and good afternoon, everyone. And thank you for the invitation to tell about our national e-health services. In my presentation, I will first tell you some main points about our healthcare organization, or organizing healthcare and health information systems in Finland. Then we go to our national e-health services, called Kanta. Kanta is prescription service, National Patient Data Repository services, and My Kanta is an e-access for citizens to their patient data. And finally, the status of implementation of our national services. Some points about the organization of healthcare in Finland. As you can see, it's very fragmented. There are services in public sector and also in private organizations. In public, there are municipalities, over 300, which are responsible for arranging and financing healthcare. Of course, they can cooperate, and they form about 170 primary healthcare centers, which are producing healthcare services. And there's also 20 hospital districts and 5 university hospitals responsible for special healthcare. And private healthcare, they're producing primary and special healthcare, both occupational healthcare, and there's about 4,000 private providers and 10,000 entrepreneurs, doctors, most of them, and 600 pharmacies which are privately owned. And each of these organizations have their own electronic patient record systems, EPR. There are some points about the information systems used in public organizations, and as you see, in primary healthcare there are 6 different systems, and specialty care are 5 or 6 different systems too. And private organizations, there are a great number of systems too. Some of them are widely used, and some are more special use. Like some systems are for dental, some are physiotherapist, optometric, and they have some certain focus. And because this fragmented organization and the number of information systems, we have a lot of challenges in interoperability of the systems and exchange in patient data between the organizations. Because patients may use different service providers. They can use a private organization, private entrepreneur doctor, occupational healthcare, hospitals, all of them. And patient data is not available often. But then, that was a problem, and then we go to look for a solution. And the solution is national e-health services called Kanta. And Kanta services include e-prescription called e-recepti in Finnish. It's mainly deployed and it's for professional use. Then there's a patient data repository, like e-archive, in Finnish e-arkisto. It's just in deployment phase, and it's also for professional use. And then there's a service for citizen called My Kanta, Oma Kanta in Finnish, like e-access for the patient data stored in Kanta. It's already deployed, but it's all the time extending and increasing. Here's a picture of Kanta services. So in the blue boxes there are Kanta services like e-prescription center, patient data repository, patient summary services, and also consent and bill management services. But this is only the national side of the thing. And because every healthcare organization have their own information systems, we have had to develop all these systems to fit the requirements of Kanta services. It has been a lot of work in that. So, when the patient goes, for example, a primary healthcare center, hospital, a private healthcare provider, occupational healthcare, the service provider sent the patient record to Kanta, to patient data repository or archive, and when the patient goes another service provider, the data is available. It's available via Kanta, so it's available for service providers. And for patient, they can use My Kanta, the e-access, the patient data. They can see all the e-prescriptions, patient data which is stored in Kanta. What are the Kanta services for? They are for information sharing between healthcare providers. Of course, a patient can manage the sharing of the data. They can opt in if it's okay for them that data can't be shared, or deny some data. And national services are accessed through organizations' EPR systems. So we had to develop all of the EPRs to fit the Kanta. And citizen, one important focus group is this Oma Kanta, My Kanta, which is a web-based national user interface service for citizen. But only at the moment it's only for 18-year-old persons or older. But we are planning the system which can make the Oma Kanta available also for parents, so that parents can have access to the data of their children. Patient data repository, or e-archive. It's meant to used in sharing health record documents, which is the most important focus, but it's also an archive. So it's responsible for storing long-term storage and lifecycle management of these documents. Then we are developing patient summary services. It means that when patient data is stored in e-archive repository, we can summarize this information as summary and send this to professionals as summary. It's to be implemented in phase 2 and next years. Then there's a patient consent and bill management services. There's a consent information, so if patient is allowed to sharing the information or denied it. And also patient's will information, living will and organ donor will. And we also have in planning phase national imaging solutions. So also the images could be shared between organizations. There are some points about the patient summary, because it's a very, very important in our future development. Summary, some most important data which are coming to summary are diagnosis, risk factors, radiology, laboratory results, measurements, and medication. And there's a picture about what this patient summary can be in future. As you can see, there's a diagnosis, medication, laboratory results. You can organize, you can filter, you can arrange this data. It's meant to professionals who can see in one view about almost all of the patient's history. Then my Kanta, e-access to oma Kanta services, and my Kanta is citizen view to his or her prescriptions, dispensations, patient records, like these summaries, lab reports, radiology studies, medication, all this information data which concerns these patients. And via my Kanta, citizen can also manage their consent, and also this denial, and also this will manage and like the donor will. And there's a quick view to this my Kanta services. As you can see, there's a you can see the dates of the visit or hospital periods, service provider name. Then you can see all the records stored in Kanta among the visit or the dates. And then you can also check further information about, for example, laboratory results. So this is the wholeness of our Kanta services. And then about the implementation of Kanta services. As I said, e-prescription is already widely in use. In mean, in Finland is 92%. That means that 92% of our prescriptions are stored to e-prescription center. And patient data repository, its coverage is over 5 million people. There are 139 deployments done in this moment. All providers in 10 hospital districts are joined in Kanta services. 3 main information systems are fully connected, so it means that all of the service provided using these 3 systems are connected to Kanta. And now we are making deployments in public organizations, but the private healthcare is coming soon, on the autumn and next year. They are also connecting to Kanta. Usage of patient data repository. There are 3,800,000 people whose data is stored in patient data repository at this moment. It's increasing all the time fast. And also benefiting or information sharing via Kanta or data repository is increasing all the time. It's not with a lot at the moment, but it's increasing. And nowadays, the best days can have over 3,000 queries a day. So if that means that over 3,000 people whose data can be exchanged via Kanta, it's quite good. And then my Kanta for citizen, it's also increasing all the time. There are over 200,000 users, distinct users, and almost 450,000 logins per month. we have lot of work to do. We have to continue the development of Kanta services, but now we can say that Kanta is in use and it works well. Thank you.
Good afternoon, and thank you for this day, for organizers. It has been very interesting to hear all those presentations beforehand, and we stay in the practical level still, and we go to the other administrative branch in Finland, education, administration of education. So my name is Laila Puranen. I come from the National Board of Education, and the unit there where I work is student selections. And it was written in today's program that the aim is to show the revolutionary projects here today. I'm not so sure if this project is revolutionary in the worldwide or even compared to the Nordic countries. But at least in the administration of education in Finland, it has been revolutionary. Our work has changed, our ways of thinking have changed. So let's go and see what has happened, what we've been doing last couple of years. Ministry of Finance has started the action program on e-services and e-democracy. We call it SADE program in Finland. And one project of that was learners' online services, and the case which I present here is Opintopolku. But it is quite complicated entity anyway, as we can see soon. So as was asked, the structure of my presentation is the background, solution, and the benefits. Civil servants do like they are asked to do. So when we started 2011 in the Board of Education, we had the situation that we had about a dozen different separate data systems for publishing education data or implementing student selections, admissions. And they all had own maintenance and development resources, own budgets, own terminologies, own websites. We already had e-applications to our joint application and other application systems, and own technological solutions also. We were in the situation that those data systems were mostly Oracle-based, and we had to outdate them, and they were expensive. The licenses were expensive. We were working with only 2 or 3 ICT companies. So the situation was that something has to be done. And we noticed that the processes to apply, to be selected to education, they are very much similar. But we had been doing only in our own corners in certain way. We haven't been looking at what others do, and this all happened in the same Board of Education. So when this program started and we got a chance to start doing things in a new way, we decided to rebuild everything. And learners' online services we started to plan services for citizens and education providers and administration. And the principles we decided at the beginning were that it's going to be service-oriented architecture, open source code, customer-oriented approach. We are not doing data systems services for the administration. We do for citizens mostly. Of course, the officials also have the benefit of that. And we decided to use also agile methods in development. It meant that us civil servants in the Board of Education, we had to learn to work, to do projects in totally different way than ever before. We were actually sharing a room with developers, testers. We had a big room where about 50 people were working together, officials and developers. So it was totally new way of doing these things. We had many different kinds of projects, how we organized this work, and the customers were included in those projects. We started with architecture, a national reference architecture for the education sector. That was one goal, which has to be there at the bottom when we start implementing those services. And then the goal was also to build the services for the whole life cycle of people, starting from pre-primary school basic education. So the information of that and how to enroll or apply to those. And then next to post-basic education, after what is going to happen after basic education, where to apply, what kind of education is available, and then higher education, and those two are in red color because there were big changes also in the legislation in those areas. So we had a tight timetable with those. It was the first implementation in autumn 2013 when we had to have ready this application and selection system for post-basic education, vocational education and upper high schools. So that was when Opintopolku study info in English was actually taken in use. And then last autumn, we took in use application to selection to higher education. And adult education, we already have the educational data there in the Opintopolku study info, but actually the application is still coming and under the development. Then this spring, we took in use the individual study. We took in use the next one, structured and electronic curriculum and qualification framework. We call it E-perusteet, and that has been quite revolutionary work in the Board of Education since the basics of curriculum have been done now with the help of application, and it's totally electronic process at the moment, which wasn't before. So it seems to be that is one of our quite successful projects. At least the experience so far looks like that. The individual study program tool, EHOPS we call, that's still, it hasn't been taken in use, and the aim is that it's going to happen in the autumn, next autumn. Then we have a very ambitious project actually starting seriously now, register for verified competence we call it TOR. It actually started a couple of years ago, but there have been so many questions in maintenance and other things that implementation started only now. The recruitments have been done just now, and it's going to be in serious use in 2016. It means that all the certificates and degrees are gathered in the national register, and they can be used very largely, not only to student selections needs, but for employers and so on. So this is the entity actually of these projects which the work was organized. But then what practically what we were building were those services, and the idea was that one service can be used for different purposes. For example, management of application form that can be used to different kind of applications, adult education, higher education. So the basic solution is the same. And code service, we have gathered codes quite largely there, and also other officials than Board of Education uses that, and the use is going to be larger all the time. And then we have the management of education data and data of organizations and addresses and contact information service. So it means that, for example, applying system to higher education, it's going to be a combination of certain services, those services, and application to adult education is going to be a little bit different kind of combination of those services. And it's not going to stay in that stage. There are going to be more services, but all the time we try to think that the use of them is as large as possible, and we do things only once. And then in the end, those benefits. Of course, for learners and student counselors, it is easy now that all the data of education and all the data of applying to education is in the same website. So you don't need to remember more than one address. And it's actually in the same type of structure, so it's easy to compare the data from all kind of education. So it's easy to compare. It's real time, available all the time, and then accessibility has been taken notice also for applicants of special needs. And then for education providers, of course, when the code is open and the technological solutions have been chosen by open source, it should be easy to use them, easier than before our systems were. And they are also free of charge. So if schools or other educational providers want to use them, it should be quite easy. And for national administration, there is that benefit that we don't have to acquire the whole data system now. If something is wrong and we have to fix something, beforehand it was quite hard to fix only one part since it was the whole system. Now it's easier to fix. And then we actually don't have to buy the whole data systems. We actually purchase resources. At the moment, we have workers from maybe 20 different ICT companies working for us. So we can buy the resources, not the systems. So in future, it should be saving costs. That was one of the reasons, of course, why we went to this reform. Here are some amounts, numbers. At the beginning of this year, first 4 months, we had almost 500,000 average visits per month. So we can say that this service has been found well. And the use of Opintopolku study info, studieinfo på svenska, the use of it is not uneven. We have those top days we call when the first day or the last day of joint application is going on. So those days are the days of heavy use. And then we have users of different countries, of course, since higher education, especially of Finland, interests many other countries. There's a picture of study info. This is the English version. This is not the same than we had in English and Swedish. English and Swedish are exactly the same, since we have English and Swedish as national languages. They have to be the same contents. But English is more for higher education, actually. But you can also find there other information. And it's all the time growing and changing. And on the right side there are all the time what is happening the next. Then in the right side above, you can see log in. It means that with a strong authentication, you can get into those personal information, and you can follow up your own process of selection, and you can change your application form, etc. I think that was it, what I had time to present. Quite exactly 5 seconds left. So you can find additional information, for example, from these addresses, and don't hesitate to ask straight from us. I'm not sure how fast we can answer, since we are still very busy, at least this year, to get everything done. Thank you.
So I think what you see from these two cases is there's lots to be done, especially in the areas that involve people the most, like health and education, right? But I will be taking questions from the audience, so be ready, unless somebody immediately raises a hand. But I thought perhaps to actually start by asking both of you one question, starting with you, that health and digitizing health is usually quite a complicated thing, right? So what have been some of the biggest obstacles in your case? The progress has been impressive, but has it been easy?
No, it has been easy. There's some technical issues. It hasn't been easy to develop all of the health information systems. There are tens of them. It has been taken very much time, very much more than we expected. And of course, this is a professional use, because they had to change the ways they are writing the records. It's a functional change also. It has been quite challenging. Okay.
But from you, I would like to ask that you started off saying very clearly that you tried to work with user perspective in mind. And, you know, Estonians, us here, we are very sort of reserved. You're supposed to be even more. And so what we hear sometimes from the agencies is that, you know, okay, yes, it's nice to ask the users, but they won't tell anything anyway. What was your experience? Are the Finns, as, you know, good and talkative users? Do they give you really the input that you need?
In every joint application, for example, we have had the questionnaire for the users, and we get the feedback, and we try to take notice everything, and we ask even the degree from 4 to 10, what will you give to this questionnaire? And then we have applicants in certain groups. We have all the time have had those project groups where there have been student counselors involved and other real users. So
you pick the right people?
Sorry?
You pick the right people?
No, not in that way. I think it is important to get also those difficult people to develop things, not only those who agree with us of everything.
Right, and I guess it also is that if you ask in a good way, they will answer, right? So it's the question of how you ask is also matters, right?
That's true.
So, but questions from the audience? Yes, one in the back, Jan.
I have a question for the last speaker. I understand you are revamping the Finnish school system, that you will stop teaching subjects but teach around projects, and the kids, they learn the subjects as a part of the project. How will that affect your system?
Sorry, I couldn't hear that.
You want to repeat that? I mean, I can do it as well, but...
Okay.
Can you ask again?
I understand that the Finnish school system is changing.
Yes.
That you are stopping teaching subjects, and rather you are teaching around projects and they learn the subject as a part of the project. And my question is, how will that affect your system?
Actually, since I've been working so seriously and deeply in these systems, I don't even know what's happening there at the moment. I know that they have renewed the curriculum, but how, I don't know, I'm not sure. But of course, everything affects to our systems all the time. So we have to change them when something changes. That's how it goes in general.
Right, right. Any other questions? Oh, sorry, yes.
Hello, I had a question because I see that you have a portal for the Kanta and also a portal for education issues. And I was wondering if there's also one bigger platform that you only have to log in once, or do you use different login codes for both?
So you mean for the whole of the government and the whole of the services?
Yeah, at least electronic services.
Yeah, yeah.
The solutions are actually the same. I mean, strong authentication, they are the same in the whole Finland. But of course, we have the own login in our own branches, administrative branches. I guess so.
Yeah, and they are different and separate services for citizens. Yeah.
But I know at the same time that, well, Olli-Pekka's here somewhere. Where are you? All right, so I won't give you the word, but basically ask him as well. So there's quite a lot of work going on in Finland and actually bringing the whole of government together and digitally and creating this one gateway, right? So that might be something you have to talk about next year. All right, but let me ask you the last question, same question to both of you. People move a lot, right? Families move, students of course move, patients now will be moving. How many plans or ideas both in health field and in education field, you have on the table for linking or connecting data and cross-border with the rest of the Nordics and beyond?
I know that in the higher education there's a lot of cooperation already between Nordic countries.
But there's nothing in your pipeline like that?
I think we have been concentrated first on the national reforms, but at the same time, like universities, for example, I know that they have their own cooperation work going on, but not so much, I think, at the national level at the moment, at least in the education.
And in healthcare, we have been piloting e-prescription, like Ipsos.
Right.
It's a
so you'll be part of the whole European work?
Yeah, and there's also plans for cross-border patient summaries. I don't know when it's coming,
All right.
but I think it's coming.
All right. Well, ladies and gentlemen, give a big hand to the Finlands.